Hey everyone, thanks for being here. So let's just say it out loud. Today's topic is not exactly dinner party conversation. It's awkward, it's private, and for a lot of us, it's something we were taught never to talk about. But here's the thing I've learned after more than a decade practicing family medicine: the topics that make us the most uncomfortable, those are often the ones that save lives. So today I want to talk about something that affects every single person watching this: your bottom, your rear end, the part of your body that most people are too embarrassed to even mention. In many of our families, there's this unspoken rule: you don't talk about certain body parts, especially that one. It's seen as dirty, private, shameful. So if something goes wrong down there, pain, itching, bleeding, what do most people do? They don't call their doctor. They don't even tell their spouse, they just wait, or they secretly buy a cream from Walmart, or they tell themselves it's probably just hemorrhoids. Everyone gets those, no big deal. But today, I need to ask you to push past that discomfort, because that area you've been ignoring, it's actually one of the most sensitive early warning systems your body has. Every single uncomfortable signal it sends: pain, a lump, bleeding, itching, could be your body screaming for help. And sometimes that help needs to come fast. In my clinic, I have seen too many tragedies: patients who felt something wrong but told themselves it was nothing. Patients who waited months, sometimes years, because they were too embarrassed to say the words out loud. And by the time they finally came in, an early cancer that could have been cured with a simple surgery had already spread too far. I don't want that to happen to you or to someone you love. So today I am going to put all the awkwardness aside. I'm going to walk you step by step through 6 anal and rectal symptoms that you should absolutely never ignore. Think of this as your honest, no nonsense guide to understanding what your body is trying to tell you. Disclaimer: this is for educational purposes only. Always consult your own doctor before making changes. If you care about your health or the health of your family, please hit that subscribe button. I don't do hype here. I do real evidence-based information that can actually help you. Okay, find a quiet spot, put your headphones on if you need to, and let's start with number one. Symptom number one: the wrong kind of anal pain. Let me guess what some of you are thinking. I have hemorrhoids. My bottom hurts when I go to the bathroom. That's normal, right? And you're not wrong. For many people, the most common cause of anal pain really is hemorrhoids, or a small tear called a fissure. But here's what I need you to understand: the pain from benign conditions and the pain from something more serious, they feel completely different. And once you know the difference, you might save your own life. Let me explain. Ordinary hemorrhoid or fissure pain has a very clear trigger. It happens during or right after a bowel movement. You feel that sharp, tearing sensation. Sometimes it burns. That happens because the stool is rubbing against the hemorrhoid or the tear. But here's the key: that kind of pain usually takes a break. After 30 minutes or an hour, it starts to fade. You sit down on your couch, you relax, it gets better. The pain has gaps. It's not constantly attacking you. But pain caused by a tumor, it plays by completely different rules. If you notice that your anal pain doesn't care whether you're on the toilet or not, if you feel it even when you're just sitting quietly watching Netflix, even when you're lying in bed trying to sleep, that's different. That's concerning. Many of my patients describe this kind of pain as a deep, dull ache, a feeling of pressure like there's a golf ball or a rock stuck deep inside, a pulling sensation. Some people say it feels like a drill slowly turning, or like something heavy is just sitting there weighing them down. And no matter how you sit, no matter how you lie down, you just can't get comfortable. The worst part: this pain gets worse over time. It doesn't stay the same. It doesn't get better on its own. What starts as a mild sense of fullness or pressure slowly turns into a deep ache. And eventually, it can become sharp enough to make it hard to walk or sit in a regular chair. Why does this happen? Because tumors grow, and they don't grow quietly. Let me paint a picture for you. The anal canal and rectum are surrounded by an incredibly dense network of nerves. When a malignant tumor starts growing inside your intestine or anal canal, it doesn't just take up space. It starts invading. It pushes, it presses on those nerves. It's like a tree with roots growing into places they don't belong. And when those roots touch a nerve, your body feels pain. What's even more concerning is when that pain starts traveling. Some of my patients tell me their bottom hurts, but so does their lower back or their tailbone, or they feel a strange numbness or tingling going down their leg. That's called radiating pain. And when pain travels like that, it often means the tumor has already started pressing on deeper nerve clusters. So here's my rule, and I want you to remember this: if your anal pain only happens when you go to the bathroom and it gets better afterward, it's probably not an emergency. But if you have that persistent, deep, heavy, gnawing pain that doesn't care what you're doing, especially if it comes with lower back pain or leg numbness, please don't blame it on sitting too long at work. Don't tell yourself you just need a better office chair. This could be your body telling you something is growing in there, and you need a doctor to find out what symptom number two, a lump or hard spot you can't explain. Your shower is actually one of the best places in your house for a quick health check. Think about it. You're already cleaning yourself, you're already touching your own body. So while you're in there, take an extra 30 seconds. Many people, when they're washing, will accidentally feel a bump or a lump around their bottom. And when that happens, the first thought is almost always the same. Oh no, is that a pimple? A boil? Did a hemorrhoid fall out? And look, those things happen. An anal abscess, an external hemorrhoid, a cyst, those are all real and fairly common. But here's what I need you to understand. The way a lump feels with your fingers can tell you a whole lot about what's going on inside. Let me break this down. If the lump you feel is soft, if it feels kind of like a small water balloon or a grape, and if it's also red hot to the touch and hurts like crazy when you push on it, that is almost certainly inflammation and infection. An abscess, it's painful, yes, but it's not cancer. But if the lump you feel is different, pay close attention. If it feels hard, really hard, like a pebble, like a small rock, if you push on it and it doesn't move at all, it feels like it's attached to something deeper, like it's growing out of the muscle itself. If you try to wiggle it, it stays right where it is. And here's the really concerning part. If that hard lump gets bigger quickly over just a few weeks or a month or two, it starts the size of a small pea, then it's the size of a bean, then it's the size of a grape or a walnut, and maybe the skin over it breaks open. It starts oozing, bleeding, and there's a bad smell like something is rotting. That hard, fast growing, easily bleeding lump. That is not a hemorrhoid. That is not a pimple. That is a red flag for anal cancer or for a lower rectal cancer that has spread to nearby lymph nodes. Let me give you a simple comparison. A hemorrhoid is a clump of swollen blood vessels. It's like a varicose vein, but in your bottom, it's usually soft or squishy. It has some give to it. A malignant tumor, on the other hand, is a mass of cancer cells growing and multiplying. There's nothing soft about it. It's hard. And that hardness is a warning sign. So please, when you're in the shower, take a moment, feel around. If you find a lump that's hard, that's growing. And that doesn't move when you push on it. Don't ignore it. Don't try to pop it. Don't put random creams on it. Call your doctor and get it looked at. That one appointment could literally be the difference between life and death. Symptom number three, the itch that just won't quit. Let me start by saying this. Anal itching is miserable. I've had patients tell me it's one of the most frustrating things they've ever experienced. You can't sit through a meeting. You can't focus at work. You can't sleep at night. Some people tell me they feel like they want to take a brush and just scrub the skin off. So what causes this kind of itching? Honestly, a lot of things: hot weather, sweating, underwear that's too tight, spicy food, certain detergents, sometimes even parasites like pinworms. The most common cause I see in my clinic is something called anal eczema, which is basically just irritated skin. And here's the good news: benign itching usually gets better. You clean the area gently, you keep it dry. You try an over-the-counter anti-itch cream from CVS or Walgreens, and within a few days or a week, it starts to calm down. But there's a different kind of itching, and this is the kind that worries me. Let me give you 3 red flags to watch for. First red flag, it's stubborn. You've tried all the usual things. You're keeping clean, you're using cream, you changed your laundry detergent, but the itching just won't go away. It keeps coming back week after week, or it actually gets worse over time. Second red flag, it's wet. You don't just feel itchy, you feel damp. You notice that your underwear has stains on it, like mucus or yellowish fluid, or sometimes even blood. You clean yourself thoroughly, and then 30 minutes later, you feel wet. Again, this isn't normal sweat. This is something leaking from inside. Third red flag, your skin is changing. You've been scratching for weeks or months, and now the skin around your bottom looks different. It looks thick, leathery. The color has changed to pale gray or dark red, or you see small sores or ulcers that just won't heal no matter what you do. So why would a tumor cause this kind of deep, wet, stubborn itching? Here's what happens. A tumor growing inside your rectum isn't a quiet neighbor. It's active. It's producing fluid. A lot of fluid, mucus, inflammatory discharge, sometimes even pus as the tumor breaks down, and all of that fluid has to go somewhere. It drips down, it leaks out of your anus, and it sits against the delicate skin around your bottom hour after hour. That's like soaking your skin in irritants all day long. It causes a chemical irritation that leads to intense, deep itching. And this itching is different from surface itching. You know how a mosquito bite itches on the top layer of your skin? This itch is deeper. You feel it inside. You can scratch until you bleed. And it doesn't help because the problem isn't on the surface. The problem is inside your rectum and it's leaking out. So if your anal itching comes with constant moisture, with stains on your underwear, with skin that looks thick or ulcerated, please don't just treat it like a skin problem. Don't buy stronger and stronger anti-itch creams. The problem might not be your skin at all. The problem might be inside your rectum, and the only way to know is to have a doctor take a look. Symptom number 4, your bathroom habits change for no reason. I'm going to spend extra time on this one because in all the years I've been practicing medicine, this is the symptom that gets ignored the most. And it's also the symptom that, if you catch it early, can save your life. Let me start by defining something really important. What do I mean when I say bowel habit? Your bowel habit is your body's internal clock. It's the rhythm your intestines have settled into over years and decades. And here's the thing. Everybody's normal is a little bit different. Some of my patients have fast digestive systems. They go 2 or 3 times a day, usually after meals, as long as the stool is formed and normal. That's their normal. Other patients are like clockwork, same time every single day for 15 years. They wake up, drink a glass of water, and head to the bathroom. 5 minutes later, they're done and they feel great. That rhythm, whatever it is for you, is your baseline. It's your body's healthy routine. Now, here's what I need you to watch for if that rhythm suddenly changes. Not because you ate a giant spicy meal last night, not because you just flew back from vacation and you're jet lagged, not because you started a new medication, but for no clear reason at all. That's what doctors call a change in bowel habit. And it's a big deal. Let me describe 3 patterns. And I want you to listen carefully. Pattern 1, suddenly going much more often. Maybe you used to go once a day. Now you're running to the bathroom 3, 4, 5, 6 times a day. But here's the weird part. It's not like normal diarrhea. When you have food poisoning or a stomach virus, you get cramps, you go to the bathroom and you empty everything out. You feel better afterward. This is different. This is urgent. You feel like you have to go right now. Like you might not make it. You rush to the bathroom, you sit down, you push, and almost nothing comes out. Maybe a little bit of loose stool, maybe just a few drops of mucus, sometimes just gas. You wipe, you stand up, you pull up your pants, and 30 minutes later, the same urgent feeling comes back. You spend your whole day running back and forth to the bathroom, getting almost nothing done. This isn't your digestive system working faster. This is something inside your intestine irritating the nerve endings. That irritation is sending false signals to your brain. Your brain thinks the tank is full, but it's not full of stool. It's irritated by something else, something that shouldn't be there. Pattern 2. Suddenly can't go at all. You used to be regular, and now you haven't had a bowel movement in 3 or 4 days. You feel like you need to go. You sit on the toilet and push, but nothing comes out, or if something does come out, it's hard, dry, and painful. Why does this happen? Imagine your colon is a highway, a 4-lane road, traffic flows smoothly. Now imagine someone builds a wall across 2 of those lanes, or imagine a car crash blocking the road. That's what a tumor does. It grows inside your intestine and physically blocks the path. Stool builds up behind that blockage. It sits there for too long. All the water gets sucked out of it. It becomes hard and dry. And now you're constipated, not because you aren't drinking enough water, but because there's a physical roadblock inside you. Pattern 3, the switch back and forth. This one tricks almost everyone. Let me describe what my patients tell me. Doc, my stomach is so weird. For 2 or 3 days, I can't go at all. I'm completely backed up. So I take a gentle laxative and then suddenly I can't stop going, explosive diarrhea all day. So I take some anti-diarrhea medicine and then I'm clogged up again. It's like a roller coaster: constipation, then diarrhea, then constipation again. Does that sound familiar? Let me explain why this happens, because once you understand it, it makes perfect sense. Remember that tumor acting like a roadblock. When solid stool gets stuck behind it, you're constipated, but your intestine isn't stupid. It senses that something is stuck, so it starts pushing harder. It contracts and squeezes, and to help move things along, it releases extra fluid and mucus into the intestine to lubricate the path. Now, what happens to that hard, dry stool that was stuck? It sits in that extra fluid, it soaks, it softens eventually. It turns into liquid mush, and that liquid mush finds a way to squeeze past the tumor through whatever tiny space is left between the tumor and the intestinal wall. Whoosh, it all comes out at once. You think you have diarrhea, but once that liquid stool is gone, the next batch of solid stool comes down and gets stuck behind the tumor again, and you're constipated again. It's a vicious cycle of stuck, unstuck, unstuck, unstuck. This pattern constipation alternating with diarrhea is a classic warning sign for a tumor causing a partial blockage. It is not just a sensitive stomach. It is not irritable bowel syndrome until proven otherwise. It is a physical problem with the structure of your intestine. One more thing, a very specific feeling called tenesmus. That's a fancy medical word, but the feeling is very simple. Have you ever felt like you need to have a bowel movement? Right now, urgently, you run to the bathroom, you sit down, you push, and almost nothing comes out. Maybe a tiny bit of stool, maybe just a drop of mucus or blood. But here's the worst part. You wipe, you stand up, you pull up your pants, and you still feel like you have to go. You feel heavy down there, like there's still something sitting in your rectum that needs to come out. So you sit down again, push again, nothing. This feeling is called tenesmus, and it's one of the most specific warning signs for rectal cancer. Why does this happen? Because your body is being tricked. Normally, the urge to have a bowel movement happens when stool fills your rectum, the rectal wall stretches, pressure sensors send a signal to your brain, the tank is full, time to empty. You go to the bathroom, you empty your rectum, the pressure goes away, the feeling stops. But when a tumor is growing inside your rectum, it's taking up space. It's pressing on those same pressure sensors. Your brain gets the signal, something is in here, the tank is full, but it's not stool, it's a tumor. Your brain doesn't know the difference, it just knows something is there. So it keeps telling you to go to the bathroom, and you keep trying. But you can't empty a tumor, it's attached to your body, it's not going anywhere. On top of that, many malignant tumors are inflamed. They're ulcerated, they're leaking blood and pus and mucus. All of that material also irritates the rectal lining, keeping those nerves constantly fired up. So your brain never gets the all clear signal. So here's my bottom line on symptom number 4. If your normal bowel rhythm has changed for no good reason, if you're going more often but not emptying, if you're constipated when you've never been constipated before, if you're flipping back and forth between constipation and diarrhea, or if you have that horrible, persistent feeling that you're never quite done, please don't buy laxatives, don't buy detox teas. Don't take anti-diarrhea medicine from the drugstore. Don't tell yourself it's just stress or a sensitive stomach. Go see your doctor. You need to figure out what's causing that change, and until a doctor tells you otherwise, you need to assume it could be serious. I've seen too many patients who waited 6 months, a year, sometimes longer. They treated themselves, they felt better for a few days, then worse, they treated themselves again, and by the time they finally came to see me, the tumor had completely blocked their intestine, or it had already spread to the liver, and that is a tragedy that could have been prevented. Symptom number 5, blood in your stool or black tarry stools. I need you to listen very carefully to this section because in all my years of practice, this is where I've seen the most heartbreaking mistakes. I cannot tell you how many times I've sat in an exam room with a patient or a family member and heard these words, if only we hadn't assumed it was just hemorrhoids, if only we had come in sooner. Would things be different? Even today, with all the medical advances we have, most people who see blood in their stool still assume it's hemorrhoids. And I understand why hemorrhoids are incredibly common, but that assumption, that quick dismissal, can close the only window you have to catch a cancer early when it's still curable. So let me teach you the difference. Once you know what to look for, it's actually not that hard. First, let's talk about hemorrhoid bleeding. Hemorrhoids are swollen blood vessels at the very end of your rectum or around your anus. When you push hard during a bowel movement, especially if your stool is hard and dry, those swollen vessels can get scratched or torn. The blood comes out fresh. Here's what hemorrhoid bleeding looks like. The color is bright red, fire engine red, the same color as when you accidentally cut your finger while chopping vegetables. That's because the blood is coming straight from a blood vessel and going right into the toilet bowl. It hasn't had time to change color. The way it comes out is usually pretty dramatic. Some people describe it as spraying. You push, and blood shoots out like a squirt gun and splashes the side of the toilet bowl, or it drips. You'll see drops of blood falling into the water after the stool comes out. And here's the most important difference with hemorrhoids. The blood is separate from the stool. You'll see blood on the surface of the poop, or in the water, or on the toilet paper when you wipe, but the blood and the poop are not mixed together. They're separate, blood here, stool there, clear border. Usually the bleeding stops pretty quickly after you finish. Your anal muscles clench, they squeeze the blood vessels, and the bleeding stops on its own. That's classic benign bleeding, and it's usually nothing to panic about. Now let's talk about bleeding from a tumor. This looks completely different. Remember that a tumor is a mass of abnormal cells growing inside your intestine. It grows fast, so fast that the blood supply can't always keep up. Parts of the tumor don't get enough oxygen. They start to die, they break down, they bleed, and this bleeding happens deep inside your body, not right at the exit. So by the time that blood comes out, it's been inside your intestine for a while, and during that time it changes. The first difference, the color is dark. It's not bright red anymore. It's dark red maroon, the color of old liver or dark cherry jam. It looks old, it looks stale because it is old. It's been sitting inside you, mixing with digestive fluids for hours or even days. The second difference, the blood is mixed into the stool. With hemorrhoids, the blood sits on top. With a tumor, The blood is stirred into the stool like chocolate chips in cookie dough. You can't separate them. The stool itself looks dark red or brownish red all the way through. The third difference, and this is the one I really need you to remember, there's often mucus or pus when a tumor breaks down. It doesn't just bleed. It oozes, it leaks tissue fluid, it sheds dead cells. All of that gunk mixes with the blood to create something doctors call mucoid bloody stool. If you see stool that looks like red jelly, or that has strings of slime or mucus running through it, or that has yellowish white pus mixed in, that is not hemorrhoids. That is not normal. That is a sign that something inside you is breaking down and rotting. So here's a simple test you can do. I know it's not pleasant, but look before you flush. Bright red blood, separate from the stool dripping or spraying, probably hemorrhoids, but still get it checked. Dark maroon blood mixed into the stool, especially with mucus or slime, that is a warning sign. Do not ignore it. One more type of bleeding, even more hidden, even more dangerous. If the tumor is higher up in your colon, farther away from your anus, the blood has a very long journey before it comes out. During that journey, your digestive juices break down the red blood cells. The iron in the blood gets chemically changed. It turns from red to black. So what comes out isn't red at all. It's black, and not just dark brown, jet black, like fresh asphalt or black coffee grounds. And it's sticky. It looks like tar. When you wipe, it's thick and goopy. And it has a horrible, sweet, metallic, rotten smell. This is called melena, and it means you are bleeding from somewhere higher up in your intestine. The bleeding could be from a tumor, an ulcer, or something else, but it is always a medical emergency. So if your stool looks like black tar, do not wait. Do not watch it for a few days to see if it goes away. Call your doctor today. Now, here's something that trips people up every single time. Sometimes a tumor bleeds, then stops bleeding, then bleeds again. It's called intermittent bleeding. You see blood for 2 days, then nothing for a week. So you tell yourself, see, it stopped. It must not have been serious. But here's what's really happening. The tumor bled, then a scab formed over the bleeding spot. For a few days, the scab holds, no bleeding, but that scab is fragile. It's not healthy tissue, it breaks off, and the tumor starts bleeding again. This is why some people use hemorrhoid cream and think it worked. They use it for a few days, the bleeding stops, they think the cream fixed the problem, but the cream didn't do anything to the tumor. The tumor just stopped bleeding on its own temporarily, and a week later, when the bleeding starts again, they just use more cream. I've seen patients do this for 6 months, for a year. By the time they finally came in, the cancer was no longer curable. So please, if you see blood in your stool, don't play doctor, don't assume, don't wait to see if it goes away. Get it checked. If it's nothing, you spent a copay and you have peace of mind. If it's something, you've just bought yourself time, and time is everything with cancer. Symptom number 6, your stool suddenly looks strange. This one is simple, but it's important. Healthy stool from a healthy colon is shaped like a banana. It's cylindrical, about an inch thick, smooth surface. That's because your intestine is a tube, and it shapes the stool as it passes through. Now imagine you have a garden hose, water runs through it smoothly, but what happens if you put a rock inside the hose? The water has to squeeze around the rock. When it comes out the other end, it's not round anymore. It's flat on one side, or it's squished into a weird shape. That's exactly what a tumor does inside your colon. It's a rock in the hose. So if your stool suddenly changes shape, pay attention. Is it suddenly very thin, like the width of a pencil or a skinny straw? Is it flat, like a ribbon or a piece of tape? Does it have a deep groove or dent on one side? The same dent every time you go. Those changes mean your intestine has become narrow in one spot. Something is taking up space inside and squeezing the stool as it passes by. In many cases, that something is a tumor. Now, let me be honest with you. If you're seeing this kind of shape change, the tumor has probably been growing for a while. It's not tiny anymore. It's big enough to physically change the shape of your poop. That's why you need to act quickly. If you ignore this, the next step could be a complete blockage. That means no stool can get through at all. You'll stop being able to poop entirely. Your belly will swell up like a drum. You'll be in severe pain, and that is a surgical emergency. So if your poop looks like a pencil or a ribbon, don't tell yourself you just need more fiber. Don't assume it's nothing. Get checked. Let me pause here for a moment. I know that some of you watching might be feeling anxious right now. You're thinking, I have one of these symptoms. Do I have cancer? Please take a breath. Having one of these symptoms does not automatically mean you have cancer. There are many benign conditions that can cause these same symptoms: hemorrhoids, fissures, infections. Inflammatory bowel disease, irritable bowel syndrome, but here's the point, you don't know which one it is, and the only way to know is to let a doctor examine you. That's it, an exam. Maybe a simple finger exam, maybe a colonoscopy if needed. So why do people ignore these symptoms for months or even years? Honestly, fear, embarrassment, and the feeling that seeing a doctor will be uncomfortable or expensive. Let me address the embarrassment head on because this is real. Many of my patients have told me they didn't want to come in because they didn't want to take off their pants. They didn't want a stranger putting a finger in their bottom. The idea made them so uncomfortable that they just didn't come. I understand that, I really do. But let me share a number with you that might change how you think about this. In many studies, up to 80% of colorectal cancers that are located in the lower rectum can be detected with a simple gloved finger exam. That's it, a lubricated finger, 30 seconds. Your doctor feels for a lump, feels for hardness, looks at the glove for blood afterward. That's it, 30 seconds, a few dollars of copay. And it can detect the majority of cancers in that area. But here's the sad truth. In many health screenings, the finger exam is the one that people refuse most often. They are too embarrassed, so they check the box that says, I decline, and they walk away, not knowing that inside their body something might be growing. Let me be very direct with you. Because I care about you in front of a doctor, your bottom is not embarrassing. It's not shameful. It's not personal. It's a body part, like your elbow, like your ear. We see them all day, every day. We do not judge. We do not remember. We are looking for one thing, disease. That's it. Your 1 minute of discomfort could buy you 30 more years of life. Isn't that worth it? And if a finger exam isn't enough, or if your symptoms suggest the problem might be higher up, your doctor will recommend a colonoscopy. I know people are afraid of colonoscopies, but let me tell you what they're actually like in 2026. You show up, you take a nap, that's it. You are completely asleep, you feel nothing, you remember nothing, you wake up, and the whole thing is over. And while you were sleeping, your doctor looked at every inch of your colon, found a small polyp, they removed it right then. That polyp would have turned into cancer in 5 or 10 years, but now it's gone. You just prevented cancer. You didn't treat it, you prevented it. I recommend that everyone starting at age 45 get a colonoscopy earlier if you have a family history. It's one of the only cancer screenings that can actually prevent cancer, not just detect it. So please don't let embarrassment or fear be the reason you miss your chance. What about prevention? What can you do today? I also want to talk about prevention because while screening is incredibly important, there are things you can start doing today to lower your risk. Why are we seeing more colorectal cancer even in younger people? A big part of the answer is diet and lifestyle. Many of us eat what I call the 3 highs and 1 low diet: high fat, high protein, high calories, low fiber. Think about a typical American meal: a large burger, French fries, a soda, maybe a cookie afterward. Where's the fiber? Where are the vegetables? Where are the beans, the whole grains, the roughage? When you eat a low fiber diet, the waste moves slowly through your colon. It sits there, and the longer it sits, the longer any potential cancer causing substances stay in contact with your intestinal lining. That's a problem. So let me give you 4 practical things you can do. 1, eat more plants, vegetables, fruits, beans, lentils, brown rice, oatmeal, quinoa. These foods are rich in fiber. Think of fiber as a scrub brush for your colon. It sweeps things through, it keeps waste moving, it dilutes any harmful substances. Aim for at least 25 to 30 grams of fiber per day. Most Americans get about half that. 2, go easy on red and processed meat. The World Health Organization has classified processed meats like bacon, sausage, hot dogs, ham, and deli meat as carcinogens. That means they definitely increase your cancer risk. Red meat like beef, pork, and lamb is classified as probably carcinogenic. You don't have to become a vegetarian, but try to make red meat a once or twice a week thing, not an everyday thing. Swap in chicken, turkey, or fish more often. 3, drink water and move your body. Water keeps everything flowing smoothly. And exercise. It doesn't just help your heart and your weight, it speeds up your digestion. It reduces inflammation. It boosts your immune system. You don't need to run a marathon. A 30-minute brisk walk every day makes a real difference. 4, pay attention and get screened. Look before you flush. I know it's not glamorous, but you are the only person who sees your stool every single day. If something changes, you'll be the first to know. And when you turn 45, get that colonoscopy. It could save your life. Let me wrap this up. Your body is an incredibly complex, beautiful machine. And that part of you that you're too embarrassed to talk about, it's not just an exit, it's an alarm system, it's a messenger. When you feel pain that doesn't go away, When you find a hard lump that's growing, when the itching never stops, especially with moisture, when your bathroom habits change for no reason, when you see dark blood, mucus, or black tar, when your stool suddenly looks like a pencil, those are not small things. Those are your body trying to get your attention. Please listen. If you get checked and it's just hemorrhoids, that's a win. You celebrate, you treat the hemorrhoids, and you go home with peace of mind. But if it's the thing we're all worried about, your willingness to have one uncomfortable conversation with your doctor could save your life. It could mean catching cancer early when it's still curable with surgery alone before it spreads, before it becomes a much harder fight. Don't let embarrassment be the reason you miss that chance. If this video helped you or if you learned something you didn't know before, please share it, send it to your partner, send it to your parents, send it to your siblings, post it in your family group chat. You might be the reason someone finally makes that appointment. And that is a good thing if you have your own experience with these symptoms, or if you've had a colonoscopy and want to encourage others, drop a comment below. Let's break the silence together. Let's help each other stay healthy. And remember, if you're dealing with any health concerns, please schedule a visit with your primary care doctor. I'm here to help you understand the science, not replace professional medical advice. Take care of yourselves, pay attention to what your body is telling you, and I'll see you in the next video.